When we look at some of the initial data that characterized COVID in children, here's one of the earlier studies that looked at over 2,000 children with COVID in China. And most of the children who were seen to be getting into trouble were the younger kids. Preschool children and infants were more likely to have severe manifestations compared with older children. And this slide, again, appears more complicated than what I want you to focus on. And I just want you to focus on the kids who are less than 1 to 5, and they accounted for a greater proportion of severe disease and critical disease compared with the other age groups. So it does appear that the younger kids seem to be more likely to get into trouble compared with their older counterparts. But we obviously need more data. These are data looking at the characteristics and outcomes of regular coronavirus infection in children, and what is the role of other viruses and the immunocompromised state, study done by one of my colleagues in the United States. And what the group showed, Janet England and her colleagues from Seattle, were that younger age, underlying lung disease, and the immunocompromising state, a respiratory co-pathogen such as RSV, were associated with more severe disease in children. In this regard, RSV, which is the respiratory syncytial virus, that typically runs between November and mid-March or so in North America, would increase the risk of severe lung disease in a COVID-positive patient by greater than 5 times. And so this is of some concern as one thinks of next fall and the potential that we could have the coming together of COVID as well as RSV and possibly flu. It's something for us to bear in mind. And in the next slide here, I'm showing you risk factors for severe disease in influenza illness. And we don't have a lot of data to go by to guide us with respect to COVID. But what we do know is that there are certain risk factors that have been identified as being a problem in individuals with influenza, and we've used that to guide us to some degree. And so we can have some more discussion about this, but this is what we've used to guide us as far as the likelihood of individuals having problems with COVID. Now, as far as kids with weakened immune systems, this has been alluded to before, trying to create a shield around them. We call that in infectious disease and public health the cocooning effect, essentially trying to create a protective barrier around these individuals so that people don't bring infection into their inner circle, so to speak. It's likely that kids with weakened immune systems might have higher virus loads, a greater tendency for transmission, possibly prolonged shedding, likelihood that that might happen, and of course, the risk of severe disease. We'll have to deal with the potential that these individuals might not have been able to mount adequate antibody responses, and as such, perhaps might be at risk of reinfection. So this is something that we'll have to keep an eye on as we move forward. So I know there's a lot to cover. We'll have a lot to talk about, but I'll stop there and then we will get back to you in the question and answer section.